Ear infections are a common condition among children, and they can cause discomfort and pain. Understanding the causes, symptoms, and treatment options can help parents recognize and address this common childhood ailment. Causes: ear infections are caused by the buildup of fluid and bacteria in the middle ear. This fluid buildup can occur when the eustachian tubes, which connect the middle ear to the back of the throat, become blocked. Children are more prone to ear infections than adults because their eustachian tubes are shorter and more horizontal, making it easier for bacteria and viruses to enter the middle ear. Symptoms: the symptoms of an ear infection can vary, but some common ones include ear pain, fever, irritability, difficulty sleeping, tugging or pulling at the ear, difficulty hearing or responding to sounds. Parents should look out for these symptoms, especially if their child has had a recent cold or other respiratory infection. If left untreated, ear infections can lead to more serious complications, such as hearing loss and the spread of infection to other areas of the body. Diagnosis and treatment: to diagnose an ear infection, a doctor will usually use an otoscope to examine the inside of the ear. If there is redness, swelling, or fluid behind the eardrum, it may indicate an infection. Treatment options can vary depending on the severity of the infection. For mild cases, the doctor may recommend pain relief medication, such as acetaminophen or ibuprofen, and rest. If the infection is bacterial, the doctor may prescribe antibiotics. In some cases, if the ear infection is recurrent or severe, the doctor may recommend the placement of ear tubes to help improve ventilation and prevent future infections. Prevention: there are some things that parents can do to help prevent ear infections. One of the most important things is to make sure that their child receives all recommended vaccines, as many of these vaccines can help prevent infections that can lead to ear infections. It's also important to practice good hygiene, such as washing hands regularly, especially before and after meals, and avoiding contact with sick people. Additionally, parents can encourage their child to avoid putting objects in their ear, such as cotton swabs, as this can damage the ear canal and increase the risk of infection. Conclusion: ear infections are a common childhood ailment, but understanding the causes, symptoms, and treatment options can help parents recognize and address them quickly. If you suspect that your child may have an ear infection, it's always best to consult with your healthcare provider for proper diagnosis and treatment. By taking preventive measures and seeking prompt medical attention, parents can help their children avoid the discomfort and potential complications of ear infections.